the entire setting for medical education creates the lesson in medical professionalism. What we need to be doing is taking the opportunity to jump on every conflict that comes up in the training and work environment, and take the opportunity to delve into that conflict in greater detail so that young physicians can develop a moral and ethical construct for making professional decisions.
As an educator, I think a lot about how do we teach students to embrace professionalism. We do it in two ways. The time-honored way of having them read the texts that enlighten them about these traditional domains, these principles. And then secondly, having them do case analysis around complicated patient cases that exemplify conflicts of interest, or a clash of values. What's so true in medical ethics is that if one emphasizes one value, it's often at the expense of another. So we have students actively grapple with that. It helps them understand how complicated the good patient care is in the context of very finite resources.
One of the things that I do is I'm responsible for giving an orientation session to all new trainees at Brigham in all specialties where I talk about professionalism. And one of the things that I do is I say that my concept is that they're in the center of, each of them is in the center of a circle of several concentric circles that are going to be around them to support them in their work. When I trained, the only circle I think that we thought of was our year in training. So it was sort of like, I think, being in the armed services apparently, where you were kind of in a boot camp with your fellow trainees and you would bond together to get through the year. And that's an incredibly important community. I think people understand now that there's many concentric communities, and they include obviously the whole program, the faculty, so the whole department, the graduate medical education if it's in training, but for faculty it might include the medical school. You know, we're all here and a part of our mission is to teach. It may include a healthcare delivery system. I mean, these are all communities that actually I think need nurturing so that we can say that we feel part of a system that we're invested in. And I think, you know, the idea of being invested in something outside just that physician-patient relationship is crucial, to be honest, only because it will support the physician-patient relationship.
We're making an effort now to do interprofessional education, bringing clinicians who will have to function on the team together as students and having them work around case analyses as if they were a team in practice, and learning how to respectfully disagree, bring different perspectives to the issue, debate effectively and respectfully, and really bring to the patient's welfare the very best of each of the professions.
I think the most important thing that medical education can do is make absolutely certain that it is continuously working on improving its own system of care in which residents and students are trained, and that it engage residents and students in being active participants in improving that system of care. In that way, these issues we've been talking about really are inculcated or inbred into the physician in the educational process.